Well, Sarah, thank you for helping us enjoy and honor the Tonys last night with some Hamilton. We're going to put up the agenda in a moment. I know we usually start with that. We were having a little technical difficulties. So Marco, I'm going to ask you to do your opening remarks and then we'll show the agenda today so you get a full scope. Thanks, Marco.
That works, Sherry. Thank you. Can everybody hear me okay? All right, I'm seeing some heads shaking. Hopefully that's not just continuing to bop to the Hamilton soundtrack versus answering my question, but if it's the former, that's fine too. I appreciate everybody joining us today. Again, I am also having technical difficulties today, so I'm hopeful that I will be able to stay connected with you throughout the meeting. But good afternoon and almost noon, everyone. And I'm so glad that everybody was able to join us. As Sherry has shared, I am Marco Giordano, your CEO. And can you all believe that September has come and as soon will be gone? It is amazing how quickly time is passing, while also at moments time feels like it is going so slow. As we all struggle with time, please take care of your well-being along the way. And while we work through our day today and work through the challenges that COVID and the pandemic has brought to us, but also just the challenging environment that we're working in as we've talked about in the past, let's also remember to celebrate our community and also our diversity. And to that end, I wanted to spend a little bit of time today recognizing National Hispanic Heritage Month. So as many of you know, that this month marks the start of National Hispanic Heritage Month. Each year, Americans observe National Hispanic Heritage Month from September 15th to October 15th by celebrating the histories, the cultures, and contributions of American citizens whose ancestors came from Spain, Mexico, the Caribbean, or the Caribbean, however you want to say it, and Central and South America. Here's a short little video to share a little bit more about Hispanic Heritage Month. Thanks, Sarah. I hope everyone learned a little something about National Hispanic Heritage Month from that video. I know I did as I watched it this morning. And so how will you all celebrate National Hispanic Heritage Month? Let's join our Hispanic community in celebrating National Hispanic Heritage Month by enjoying a classic Latin American dish, by reading books by Hispanic and Latinx authors, supporting Hispanic and Latino-owned businesses, holding your own Spanish language film or music fest. There's a laundry list of great activities that anybody can participate in to really celebrate and join our Hispanic community in celebrating National Hispanic Heritage Month. I'm going to ask Sarah to put a link that I surfaced, and maybe not the official link, and I'm sure there are many others I felt was a great opportunity to share some activities with folks. If Sarah, you can put that in the chat. And as we all continue our time together through this meeting, but also as we go on to our day-to-day, remember here at RHD, we value diversity, we value inclusion. Our diversity provides richness to our organizational culture. We celebrate at RHD all cultures and ethnicities. Let's also take the time to ensure that we are opening the doors widely to invite all cultures and ethnicities into our community. So celebrate and enjoy Hispanic Heritage Month. Before I pass the mic back to Sherry, I just want to share a couple final thoughts with you all. Today, we have a full agenda focused on our continued response to the vaccine mandates in Philadelphia, Delaware, and Connecticut. And as a reminder, we are also asking every fully vaccinated employee at RHD in every state and service line to submit your proof of vaccination via the online reporting tool available through Okta. We ask all vaccinated staff to submit their information by the end of this week. And if you have not done so already, we ask staff in Philadelphia, Delaware, and Connecticut to do so today. Having this information available will allow us to continue to respond in the most effective way to the mandates currently in front of us. Again, thank you all for joining us today, and I'll pass the mic back over to Sherry.
Thanks, Marco. And I'm going to ask Sarah to pull up the agenda. And the agenda with the, that also is the housekeeping. Yep, great, thank you. So I do want to note it's going to look a little bit differently today in that after the housekeeping that I'm doing now, Brian will give us the COVID update and with the numbers, and then we're going to open it up to a general Q&A session for everyone. After that, you can decide what makes sense for you if you want to stay on. But that next section will be focused on Philadelphia, Delaware, and Connecticut staff, specifically around the testing protocols and exemptions. So we welcome all of you to stay. It's interesting information. This information might be important to you. Right now, we have to really make sure Philadelphia, Delaware, and Connecticut really has this information very specifically. We have taken the questions from last week to answer some of these. And again, Sarah sent out an email from the RHD Sarah COVID-19. So please also look at that where you can read the questions and the answers in detail. As always, we encourage you to submit your questions either through your voice, the COVID-19 inbox, the Zoom chat. You can always use the raised hand function. Some people will send them to Sarah, so she's always checking her email as well. And then one last thing that I want to add, just when you ask questions, please try to give us enough specific information so we can really answer the question accurately. Sometimes it's hard for us to know the nuances of the question. And then recognize that sometimes we do really need to direct you to your program leadership because the real answer to the question resides there. So I hope that's helpful as you submit your questions today. So Sarah, I think that's it for the agenda. And let me turn it to Brian to give us an update on the COVID numbers.
Thanks, Sherry. Can everybody hear me? Awesome. Thank you. Good afternoon, everybody. Currently, we have received 3,024 reports since March of 2020. So of those reports, the breakdown is as follows. We've had 849 confirmed reports, 1,512 negative reports, 83 suspected, and 570 possible exposures. Now, at this time, I'm going to share my screen with you to look at the chart that we have normally been looking at here. All right, so everybody should be able to see my chart at this point. I know it might look a little small, but I know we've got a lot of information on here now. So basically, we've seen an active August, and it really kind of led into September as well. But what I really want to point out here is the most recent spike that we saw the week ending of 9/18. We saw a lot of reports come in, and of those reports, we saw 11 confirmed reports for COVID. You'll also see, or maybe you see, it's a little small, this yellow bar right here represents the possible exposures related to those confirmed COVID reports, and that's 59. So, to put this a little bit in perspective too, I kind of went back and looked since the beginning of August to really look at what was going on. So since the beginning of August, we've had about 6.5 confirmed cases of COVID a week. So, we're seeing a steady number of reports come in, and that number, like I said, we saw those 11 confirmed reports, which is really what generated those other possible exposures to those 11 cases. So what we're also going to see over the next couple weeks is we're going to see those numbers, those possible exposure numbers, they should convert to either a confirmed status or a negative status, because we do look for updates from the programs to see what happened with those cases. So stay tuned for that. So from a national perspective, new infections and hospitalizations have actually been declining, although we have seen some numbers creeping up in Maine. And just interestingly enough, Alaska is the new hotspot. So they've really seen a dramatic increase in the number of confirmed cases. So just one last thing I would like to leave everybody with is that fall is here, and we're going to be spending more time indoors soon. And, the weather's getting cooler, the days are getting shorter. So we really just want to make sure that we are just remaining vigilant and continuing to practice our COVID safety measures. Looking back at the chart that we're looking at right now, Halloween is where we saw that dramatic spike that we saw last year. And it really kind of took off, and it lasted until, through the winter. So, just something to keep in mind moving forward here. So, Sherry, that is my update for today. I'm going to stop sharing my screen, and I'm going to pass it back to you.
Great, thank you, Brian. And I appreciate that reminder coming into fall. Interesting to see those numbers. So as I said, we're going to open it up to a general Q&A, knowing that we're going to get more specific about testing and exemptions after this. And again, just to be specific about your questions. So let me check in with Sarah and see if she has any questions, and I'll take a look at the chat.
Sherry, not so far for me.
Okay. And I am not seeing anything in the chat. Let me just pause for one more moment. Oh,
Yeah, as I say, we might need to just give people some time.
yeah. So we'll take a pause, see if it comes up. We can use this as always for some nice big deep breaths. So let me, here we go. Here's one from the chat. When will we know if exemptions were granted? So we're going to do a whole piece on exemptions. So I'm going to just hold that one for a second. And the next one is around testing. So I'm going to say before, I will make sure to jot those questions down. But let me ask Bernie and or Sandy to talk through the testing protocols. And then we can open it up for Q&A for testing.
Thank you, Sherry. So the testing protocol is connected back to the mandate. So not to confuse folks, but on a high level, we have mandates currently in 3 different areas. in which RHD is providing services. In Connecticut, and the effective date for Connecticut is today. And the mandate in Connecticut is that folks have to be either fully vaccinated or test weekly. In Delaware, we have a mandate, and the effective date for Delaware is 9/30, which is later this week, as I know you all know. The mandate in Delaware, like Connecticut, is that you either need to be fully vaccinated or you need to be tested weekly. Sandy, did you want to talk about the mandate for Philly?
Yes, the mandate for Philly, you have to be fully vaccinated by the 15th of October. And if not, someone put a question up about how many times they need to be tested a week. The answer to that, in Philadelphia, you need to be tested twice a week with a few days in between. Unlike Delaware and Connecticut, where it's only one time a week. And I think the question that Michelle asked was, will you be allowed to work if you're tested twice a week? Absolutely, if the results are negative.
Right. The only thing I would add to that, and I'm sure most folks in Philly know because we've been talking about this, is that in Philly, you've either got to be fully vaccinated or qualify for either a medical or religious exemption. And only if you qualify for the medical or religious exemption, then you need to do the testing twice a week, like Sandy said, with a couple days between.
Right. Thank you, Bernie.
Yep, team.
I have a question, Cherry. The question is, do staff still have to wait 2 weeks after getting their second shot if their second shot is after October 15th?
So the response for, I'm going to assume that's a Philly question because of the October 15th date.
Mhm.
So the response, and Sandy, go ahead, Sandy.
Yes, there is still 2-week waiting period. Unless you are able to work remotely, there still is a waiting period in between. Or I think recently I just read, and Emily, please correct me if I'm wrong, that if you get the vaccine and you double mask, or you have an NY95 mask, is a 2-week period. Does it still apply?
So there is a recent clarification on that, Sandy, through our provider agency. So if you have either the one Johnson & Johnson or both Pfizer and Moderna vaccines by the 15th, the 2-week period can be waived, like Sandy said, with either one or two reasons. One, if you're able to work 100% remotely for those 2 weeks, or two, you would need to test twice a week, double mask, and follow all the other protocols.
Double mask and 95.
Social distancing and everything else, yes. But and then once that 2-week period passed, then you would go into the mandate protocols for vaccinated as opposed to exemption.
Fully vaccinated. Yep.
There's a question in there also around the testing, which is, what is the reason for twice a week? I'm assuming that is for Philadelphia.
Well, that's a part of the mandate. That's what's being required for us. That's what's being, mandated in Philadelphia.
Thank you.
Can I jump in there for a second? Emily or June, could either one of you maybe provide the science behind why the city may be asking us to test twice a week?
Sure, happy to. So especially with the Delta variant, the sort of incubation period or the time that we are infectious has decreased. So it's a shorter time and we can identify it quicker. And so that is why they're asking for twice a week with at least 2 to 3 days in between the tests. So we can pick up infection quicker and hopefully at an earlier stage of being infectious.
Yeah, the CDC says 3 to 5 day windows, so that would accommodate twice a week.
Great, thank you. And I think, I know we're jumping around a little bit but Emily, since you have your self up there, I don't know if you want to answer the question about the booster shot that came in.
Sure, happy to. So just a couple days ago, a booster shot was approved for those who received Pfizer COVID vaccine. I do want to start off with the information saying, please talk to your healthcare provider to see if you are eligible for the booster. But what has been stated in terms of who is eligible? One, you have had to have received 2 doses of Pfizer. So I'm going to keep repeating that. So if you receive Moderna or J&J, you are not eligible for the Pfizer booster. You have had to have received Pfizer. People who are 65 or older, anyone 18 and older who are living in a long-term care setting, and anyone ages 50 to 64 with an underlying medical condition. I can put in the chat the link to what it does an underlying medical condition mean, which I will do in a minute. Anyone 18 to 64 at an increased risk for COVID-19 exposure because of occupational or institutional setting. That's where it applies to us. So anybody at RHD who received Pfizer, and it also has to be 6 months from your second dose. So please keep that in mind as well. And so the vaccines are available pretty much anywhere you can get vaccines. So I would suggest if you fall into any of these categories, or if you have consumers, you can provide them information about getting the booster shot.
Great, thank you, Emily. So there's a lot of different questions in here. I'm trying to just stay on one topic at a time. So I'm going to go back to the testing. Just noting, I see a lot about exemption. I'm not ignoring them. I'm just trying to stay in one topic. So the next one I see is, why is the vaccinated not required to test twice a week? Because from the CDC, they can still spread and get infected.
So I would say that we are following the mandate for the requirements, whether it's in Connecticut, Delaware, or Philadelphia right now. Where we're following CDC, for right now, we're following the mandates where mandates apply. The mandates are saying in Connecticut and in Delaware, you have to test weekly. And in Philadelphia, if you're not vaccinated, you have to test twice a week.
Yeah, and I believe Bernie also, and Emily, hop in here. If you're vaccinated, you're not as likely to be affected. So that's why the testing may not be economical in that sense. Sometimes it doesn't pick it up, but if you're unvaccinated, that's where we really want people to get the testing, because that is for their own health and others who they come in contact with.
So I see another one about testing. Where can they, I'm assuming that they as employees, get tested, since they are not responsible for paying for a test?
There's a lot of different outlets to get tested. Some you have to make appointments for, and some you do not. I believe all of the pharmacies, Rite Aid, CVS, and also FPCN is offering on appointment to get vaccinated. Am I correct, Emily, on appointment? Yeah. So
Yes.
there's, go ahead, Emily. You wanted to say something?
Just agreeing, yes.
Oh, okay. So there are many avenues to get tested, and we also have our procurement expert working on trying to find other outlets so that you're able to go and get vaccinated as you need to.
I would jump in and talk about Connecticut and Delaware briefly. Also in Delaware, like Sandy said, there are multiple sites available, and as of right now, they're still all free in Delaware. There's a curative pop-up sites. There's pharmacies, there's Department of Health. In Connecticut, the same venues are available that are available everywhere else. And know that this is a very fluid situation in the 3 areas where we currently have mandates and in areas that we expect. I know a lot of folks have heard a lot of different information about a federal mandate that's coming. We, like you, are anxiously awaiting the details. So the answers that we're giving you today are the best answers we can as of 1 o'clock Eastern time today, because it's a very fluid situation and things keep changing. So I just wanted to make sure people understood that.
And Bernie, I don't know if this is accurate, but as we get clearer, we'll be communicating that either via email, through leadership meetings that lots of folks on these calls attend, Brandon's, Linda's, staff meetings, house meetings, and this meeting. So as we get clearer on these details, we will be communicating out to you.
That's correct. And Sherry, what we're trying to do is, as we have a specific protocol that only applies to one site, like in Connecticut, there's some testing stuff that we're doing. It's a little bit different in Connecticut. We will be, the leadership staff, the programmatic leadership staff in Connecticut will be, or in the process of, and will continue to communicate those details directly with the staff. We know there is 237 staff on this call. That's more staff than we have in Connecticut. So state or region specific mandate information, we're trying to address through regular communication with the staff, through, like you said, staff meetings. And we also offer folks in the areas, if they think it would be beneficial for us to do a Connecticut town hall meeting, a Delaware town hall meeting, a Philly meeting, we're more than welcome to do that in addition to this all agency town hall.
Great, thanks, Bernie.
And Sherry, just to add, just to really what Bernie had shared, that last week there was separate meetings held for unit directors in Connecticut, Delaware, and Philadelphia. And we can keep doing that specific to a particular region until the main questions are resolved. So, just as Bernie said, some things are in place, but we are can be responsive in different ways in different areas if need be.
Linda. So I think we've covered hopefully all the testing questions. As there's more, we'll go back to it. I'm going to go to the exemption. So I don't know if either Alicia or Stephanie want to talk first about the exemptions before we go to the questions, but I'm going to that bucket. Please know I'm not ignoring the other questions. Sheena's going to help me. So after we do the exemptions, we'll go back to some of these other questions.
Hi, Sherry. I'm on. It's Alicia. Can you hear me?
Yes.
Okay. I'm sorry, guys. I'm at the doctor's office. So in terms of exemptions, the same process that has been set up by our IT team in terms of being able to enter information into the portal. We have a different exemption request submission portal. You can access that as well on Okta if you're in Philadelphia. So that the current rule is that if you are in Philadelphia, you must be submitting your information for vaccination or submitting a request for medical or religious exemption. Once you submit that information for exemption, it will be reviewed. We have hired a third-party independent temporary staff person, not staff, but someone who has done this in other quasi-governmental organizations, who will be reviewing those exemption requests and rendering a decision. Any exemption requests that are not meeting the expectation or the requirement will be reviewed. And then the program leadership, department leadership, and staff will be informed of the decision. Once an exemption has been approved, that staff person, if you are in Philadelphia, will be required to test twice weekly, as has been stated, and to mask. If you are not approved, because I saw that question, what happens if your exemption is denied? You will immediately be furloughed if it's after the date. And to give you time, someone asked why, to give that staff person an opportunity for the first 30 days to begin the vaccination cycle. If they, after the first 30 days, have not started the vaccination process, then that staff person will be terminated. If you started it, but you have not completed the vaccination within that first 30 days, you are eligible to be considered for a second 30-day extension to complete the vaccination cycle. Anyone who has not completed the vaccination cycle, uploaded their vaccination card as well as the information at the end of that second 30-day time frame will be terminated. In Delaware, because there is an option for testing as well as vaccination, there's no exemption process in Delaware. In Connecticut, we are getting clarification, but currently it's vaccination or test. If in fact an exemption is something that Connecticut will be offering, then that opportunity will be offered and the staff will follow the same process of submitting their exemption request. I think I covered, how long will it take? Sorry, I thought I covered everything. How long will it take? Our initial this week is to get through all of the vaccinations, to confirm the vaccinations that have been entered. We have almost about $1,000 to make $1,000 vaccinations that have been submitted, just a little under that, as well as about, the last my understanding was 30 exemption requests. So we will work towards getting through those, see what the volume is, and understand the level of complexity. And then we will identify and establish a time frame for turnaround so that everyone is clear what they can expect and everyone knows what they're looking for. Reporting will be sent out to leadership, whether it's program directors, department directors, whomever the case may be, so that on a daily basis, they are clear of which staff have been vaccinated and uploaded that information, which staff have submitted and been approved for exemptions, and which staff need to be tested. So those are the only options that are available. In terms of new hire, yes, that question has come up, Sherry. I'm just going to answer it now since I do have the mic. We have begun to work on language for all people going through the new hire process to let them know that vaccinations are required so that they will be required. That was on the FAQ. We did answer that if you didn't get a chance to check your email, because I know it's been a really hectic Monday. If you get a chance, it's documented there so that you can make sure you pass that information on to anyone in your programs or your department that needs this answer and this information. Our talent acquisition team has begun to work on a few things. One, making sure that our postings for positions that are qualified or that are required to in those areas understand that vaccination documentation is required. Employees going through the new hire, when they finish fill out their new hire paperwork, will be required to complete an attestation and within 24 hours of their first day of work to submit their vaccination information into that same portal. Again, I want to make sure that everyone is clear, as I know we have already said previously, but I don't know that I heard it today, that falsification of that information, whether it's on the vaccination portal, on your exemption request, or your testing, is something that is punishable by the law, but also subject to disciplinary steps at RHD. We are securing information, which is why we're handling this information through a separate portal and not in our HRIS, and why we are hiring an external person to be able to manage the exemption requests that come through, because we want to make sure that one, we have objectivity, two, we have someone who's done this elsewhere before, and three, we can secure employees PHI. So those are very important for all of us, and we wanted to make sure that we ensured those as we went through this process of meeting expectations wherever we're being required to meet them.
Alicia, one question I'm not sure if you got, but if you did, my apologies, because I am trying to multitask here. is will there be an appeal process?
At this time, there will not. Again, this external party that we have hired to do these exemptions review has done this. This is a normal, it's not normal. Nothing about this is normal. It's COVID, right? I get that. But the accommodations review is the same process we would take in HR for Title VII that we do on a regular basis. There's a little subtle nuance here and there, but it's pretty much the same process. So an experienced person in HR and legal has the ability to do so. There will not be an appeal process for this. If there's anything that's not complete, an employee will have an opportunity within a short time frame to complete that information. But in terms of once a decision is rendered, there won't be an appeal process.
Alicia, I have
Uh-huh.
one more question for you. With regarding interviews for employment, are we allowed to ask them if they are vaccinated?
That we can share the requirement. That's why it's being shared in the posting. We can share that requirement in interviews, and employees, if they're hired, are required to sign an attestation documenting that they understand that vaccination is required. They understand that they will have to submit their information, their vaccination card, the lot number, so on and so forth, into our portal within 24 hours. And that failure to do so will be subject to immediate termination. So we're not going out and asking people their status. We're not going out and asking, but we are making sure that everyone knows that for the work that they are doing, for those areas that are qualified, that are required under these ordinances, that vaccination is required. Yes. I don't know, Sheena, if that answered the question.
I think so.
Or, okay, cool. Sherry, I don't know if there's more. I can't see the chat because I'm on a
This
pretty
new
small.
question, you kind of just answered this, but I'm just going to read it. To be clear, for new hires, is having the vaccine in order to be hired only for the mandated areas, Philadelphia, Connecticut, and Delaware, or is it corporate-wide?
As of right now, we do not have a corporate-wide mandate. So it is for those areas where it's required.
And this question, I think, is still directed to you. What safeguards will RHD take in Pennsylvania, maybe Philadelphia? This
Probably.
is Philadelphia, to ensure staff is not intentionally taking advantage of furloughs. Yes, it's for Philadelphia specifically.
So the truth of the matter is that in any situation, I'm sure there's going to be someone who will try. I can't guarantee anybody's prevention for that. What I will say is that this furlough process is RHD's attempt to try to work as much with our staff as possible. The city doesn't tell us that we have to furlough people. They just say they can't work. So there are some organizations that are going right to immediate termination. RHD, that's not who we are culturally. And I know that this whole process is frustrating for staff because it feels like this process is not RHD. RHD does try to operate with an organizational integrity to our funding and our contractors. And so this is what they're requiring. And so we're going to operate within that. That means that if staff are, again, falsifying information, trying to find a way to get around the mandate or ordinance, there's going to be a lot of different pieces that we're going to be putting in place or that we have already put in place to try to minimize that. At the end of the day, you will be required to submit a vaccination card or to have an approved exemption. You'll be required to test. If you don't, I could think the only way a staff, quote, getting around or misusing the furlough is if they never attend to get vaccinated or to get an exemption. The challenge with the furlough is it's not paid. It's unpaid. So it's really staff kind of, I guess, screw themselves. It's an unpaid vacation. So I don't know that most people count that as a vacation. I just saw that pop up. It's a vacation. They're using the furlough as a vacation. It's unpaid time. Staff will be able to use their PTO, but they will not be able to accrue any PTO. But that is the same process we would take if someone left the organization. They would be paid out their vacation. So we're not doing anything more than what we normally would do for staff. So just kind of want to put that out there. I got you, Melissa. Hopefully I answered your question. Absolutely, you're welcome, not a problem. Sheena, Sherry, I don't know if that answers the question or if there are others.
I'm letting you like monitor the questions now.
I can't see them
Um,
all. I can't see them all,
Sure.
Sherry, so I do need your
Did
help.
Sarah have some questions specifically related to this?
I do have one question about exemption requests. That question is, are staff able to work while the exemption requests are being reviewed and you are waiting for a decision, especially if the decision is not made by October 15th?
Any exemptions that I will say this, while I can't say to you, oh, exemptions are going to normally take 24 to 48 hours, I can tell you that right now, any exemptions that have been submitted today will be processed long before October 15th. Our temp is starting, our hope is tomorrow. She received her technology. She'll be beginning tomorrow. There are about 30 exemptions in the process that have been submitted, requests that have been submitted. Those will be processed. Now, if you wait until October 14th, if you're in Philadelphia to submit an exemption request, you will be furloughed, because you must be, you'll be furloughed until your exemption request is approved. And as I said, as we get further into this, then we'll be able to understand based on the volume and the demand, and whether or not Connecticut also requires the same thing, to be able to establish a regular, realistic expectation.
Okay, I have a couple more. Oh, Sarah, you good?
Yeah, I'm good. Go ahead.
Just a quick follow-up to this question someone put. So if you know for sure you're not getting vaccinated, is that terms for immediate termination?
If you know for sure that you are not interested in getting vaccinated, my statement to you would be to submit your exemption if that is what you are eligible for. You know whether or not you have the need to apply for a medical or religious exemption. But in fact, if you refuse to comply with the vaccination or exemption mandate in Philadelphia, you will technically be, I mean, it's termination, but you're basically saying you're resigning your position. The challenge you have is that this is not an RHD, Philadelphia RHD mandate. This is a City of Philadelphia mandate. And so it does apply to all providers and those who provide healthcare services or are locations where healthcare consumers would visit.
Okay.
You're going to run into this elsewhere.
One more question. Regarding Philadelphia employees who received their first vaccination shot, can they apply for temporary medical exemption, citing the second shot is not medically recommended until after a 21 or 28 day waiting period?
So anyone who has not received, we had this conversation earlier, anyone who has not started their vaccination cycle and starts it now has ample time to get through that second cycle, get through the cycle to get the second shot. So I'm going to say that if you have gotten your first shot, that shouldn't be a concern for you unless your medical provider, for some reason, advises you not to continue, and then they will be submitting that on your vaccination, your medical exemption request. That if it is a time limited request, then they will indicate that as well, and then we will need to come back so that you can comply with the ordinance once the time frame has expired, once the time frame has passed.
A few more just came in.
Mm-hmm.
Are we for, and I'm also just kind of trying to get questions that are specific for Alicia. So if I'm skipping you, it's not, I'm still getting it down. Just want to be clear.
I appreciate that, Sheena.
Are we furloughing staff who are newly hired and in the vaccination process? You kind of just answered this, but their final shots occur after the 15th. Would they be furloughed until they meet the 2-week after final shot requirement?
So if there are staff who have, so let me just say this, the Philadelphia ordinance allows for, we believe, both shots to be completed by October 15th, but you're still in your 2-week post-vaccination shot waiting period, that you can get the exemption for that period and mask and still work. anyone who has gotten the first shot, I feel like I hope I'm just not repeating the same answer I already gave. If you've gotten the first shot, you should have completed that second vaccination shot before the actual mandate. If for some reason you choose not to proceed with the second shot, you will need to apply for an exemption request and be furloughed. You will need to apply for an exemption request and be approved, or you will be furloughed. If you, within the first 30 days, do not meet exemption or vaccination standards, then you will be terminated. I feel like I just repeated the same question, the same answer, but the questions feels like the same question. So if I missed something, Sheena, please help me understand the differences, and then I can make sure that I address whoever's question it is to make sure they get the answer that they need.
I'm sorry, Alicia. It was actually if the second shot falls after the 15th. I typed it wrong.
Okay. So again, if you've gotten that first shot, your second shot won't fall after the 15th. If for some reason you wait until the last minute to get started, then yes, you very likely will be furloughed. You likely will be furloughed. We're still
Alicia,
working
how
through
about-
that and still trying to figure out what we have the ability to do. But as of right now, you will be furloughed.
Alicia, I think, and Renice, you can correct me if I'm wrong. I think the question was also focused on new hires, and particularly as we continue to hire staff during the next couple of weeks, and staff that may not be fully vaccinated, and how that will work.
Yes, like we have a new hire class starting on October 4th. Some of them are getting their vaccination this week, so that their second shot isn't going to come until after the 15th. So we're just trying to figure out what their status is.
Yeah,
Will they
I
be
think
furloughed? Just to wait until
they will have to, yeah, I think we're going to have to talk about that because that doesn't fall within the guidelines that were given to us by the city of Philadelphia. And so we'll have to have a conversation about that. My recommendation would be that since we know this and there were staff that are already in process, as we were moving into the direction of filing with the ordinance, that that they be contacted immediately to be informed if they were not, meaning like we just started posting this information in our our postings and so on and so forth. Once it came through, there were staff that had already applied long before that, so they may not have seen it because it made the postings after they already applied. My recommendation would be that you reach out to every single one of those staff. You partner with your talent acquisition team, reach out to every single one of those staff and let them know that they're going to need to be vaccinated, so that we can be proactive. I mean, to me, that's the goal for all of this, is to try to be as proactive as possible. As Renice said, if you can tell them that this is the time frame you're working on, please start your vaccination cycle. And then the rest we will work together to figure out and get back to you guys as quickly as possible.
And if I could just add one more thing to all the information Alicia provided, if there's a specific employee with a date, is it going to fall within the range? Talk to your program and division leadership, and they can together work through some of that.
Hi, Alicia. What procedures or policies are in place to allow staff opportunity to get vaccinated? Given the staff shortage and inherent challenges with scheduling medical appointments, will we allow staff time to actually go get vaccinated? Did you get that? I'm sorry.
Yep, I got that. So all of the ordinance require that staff are allowed to use sick time to get vaccinated. That is what is in many of the what's coming to us in terms of the regulations, as well as what may or may happen in other states and also federally, that staff are allowed to use sick time. So that, again, I would encourage that our programmatic leadership, CPOs, service line director, regional directors, work with our unit directors and our executives on the shared services side, work with your department directors to understand the importance of allowing test staff time to be able to use their sick time to go get vaccinated if they don't want to be unpaid. I mean, you can get it if you're working in a residential setting and you're not working 7 days a week, 24 hours a day. You have an opportunity to go get vaccinated. That's not a problem. There are many vaccination sites around the areas that we're working with. There's not a shortage. There's not currently a reported shortage of vaccinations or vaccine appointments. And so there is not an issue in terms of being able to get. And what I'm hearing is I can't get time off of work to go do it during my shift. And so you should be able to do that at many different hours of the day, but also if there is a need to do it during the day or a time when you would normally be working, you are able to use sick time. And that's not something that we need like a special policy that says you're allowed to use sick time. That is just part of what would be covered under sick time. Just like if you had to go to the ER, right? We wouldn't have a policy that says you need to go to the ER or to go get your flu shot or to anything else. We would encourage you to use your sick time for that. Mhm.
So Sheena, take a pause for a moment. I saw in the chat that Lauren would like to ask a question. So Lauren, do you want to take yourself off mute?
You just answered my question, Alicia. I just wanted to make sure there was something in place in terms of staff being able to actually go get vaccinated, given, just a shortage and how booked people's schedules can be. But you just answered it, so thank you.
All right, and so let me check in to give Sheena a little time to keep looking through these. Sarah, do you have any questions?
Not at the moment.
Okay. So Sheena, I think you're gonna have to just jump around because as I look myself, they're just in all different areas. So we did our best to try to clump them, but I think we just, go back and take them because they're really.
Coolio. All right, I'll start at the
Place.
top of the list, and then as I go down, I'll catch them in the chat. This was kind of addressed earlier, but where can they get tested since they are not responsible for paying for tests? So I guess where can employees get tested since they're not responsible for paying for the cost of tests?
So Sheena, clearly,
employees,
go ahead, Sandy.
Oh, I'm sorry. If the employees can go anywhere that tests are available, if they're free or even if there's a cost, related to the testing, then RHD will pay for it. If it's a test because you contracted COVID or you've been exposed, then your insurance company should be paying for that. Did I leave anything out, Vern?
I would say that in Delaware and Connecticut, it's a little bit different than Philly in that in Delaware, there are pop-up curative sites and pharmacies, and the testing as of right now is free in all the Delaware sites and in multiple Connecticut sites. Department of Health in all the states is available, and it's currently free there, to my understanding. If you run into a problem trying to get a test, reach out to your supervisor, because like Linda said earlier, there's always going to be one-offs that we can't answer with a blanket question. So if you have a specific situation where you're running into a problem, don't wait till when the mandates do. Let your supervisor know as soon as possible so we can work with you. We all have a common goal.
And Vern, one other thing that I would say, specific to Philadelphia, is that we are working on different potential answers to that, and that information will be coming soon. So just stay tuned because we'll have that coming soon.
And I think Stephanie had her hand up, so she might want to jump in and add.
I did. I think you got covered. I just wanted to kind of emphasize that you really do want to discuss this with your leadership because, for example, Connecticut, there's one solution that is not the same as what will be offered in Delaware. So just tap into your leadership.
Coolio. All right, I'm gonna get this question that was just in the chat, but it's kind of relevant. Some staff have jobs with other companies that require weekly testing. Can they submit the results from their other job instead of being tested for both sites, for both jobs?
Absolutely. I mean, if you get tested, you're tested. We don't want to create obstacles. So if you're already getting tested, just as long as you have, official documentation that meets the requirements of the mandate, Absolutely. We know that many of our staff work in second jobs in similar fields. So if it's a requirement elsewhere, yeah, it should apply to both.
And make sure that the testing is in accordance. I think Bernie said it. If you're supposed to be tested twice a week, that the test reflects the date in which you got tested. So if it's a 2-day test or if it's a 1-day test, you can use it if it falls within the guidelines.
Okay, so all staff are being required to be vaccinated with all participants, so all staff are being required to be vaccinated. Will all participants entering our program be vaccinated as well?
The mandates cover employees, not consumers. So we've tried to educate our consumers and give them the information they need to make their own personal decision, but the mandates only cover employees.
And I think it's important to restate that the mandate is only applicable to working in the city of Philadelphia, the state of Delaware, and the state of Connecticut.
So this was just a statement that was put in the chat earlier. Please be clear that in Philadelphia, the only people who can work while being tested twice a week are those with medical or religious exemptions. Correct. Our counties Our counties outside of Philadelphia being held to the same standard as the city because technically Philadelphia.
So right now I can say, no, the surrounding counties outside of Philadelphia do not have a similar mandate. That could change as, you know, so many things have, but right now it applies to just Philadelphia County.
And again, it's your work site, not your home address. If you live in Philadelphia but work in Montgomery County, as of right now, this does not apply to you. If you live in Montgomery County and work in Philadelphia, as of right now, it will apply to you. Same thing in Delaware and Connecticut.
Recently had my daughter, I recently had my daughter tested, which was negative, of course. But due to influx in testing, due to mandates, result turnaround time is a week or more. With that being said, staff could still potentially infect others. What protocols will be put in place to protect staff and participants to reduce this from occurring?
I think that, oh, go ahead.
We have obviously our COVID protocols. Those are posted on the COVID-19 website. Just the 4 W's, you know, wash your hands, wear a mask, use the hand sanitizer, socially distance, and try not to hover around each other. These are really good ways to minimize transmission.
Okay. How will staff shortage be handled due to the major loss of staff that will take place?
We're asking all directors to have a contingency plan and to look at how many staff, to keep in touch with how many staff will be there, how many staff will not. And so that's why we're asking for contingency plans. It could be anything from, having staff work in other sites, or it could be having sites combined. It could be all kinds of ways to make sure that the folks that we are taking care of are taken care of.
And just to add to that, that we recognize that these mandates with the goal of keeping everyone safe puts an additional pressure on a short staffing situation anyway. And so we are, we have always united around the mission of serving our participants. And so that's what we're going to continue to do, to try and figure out program by program, how can we make it work? And, what are the answers to making sure that our, that we remain staffed and providing quality services.
In Delaware, will a staff be furloughed if they did not get the weekly test within the 7-day rule?
That is how the mandate works, yes. And again, Delaware, as of right now, and let's be honest, I'm probably biased because I live in the great state of Delaware. There are multiple venues available in Delaware. Like Alicia said earlier, someone, we haven't heard of any problem with folks who want to get vaccinated, getting vaccinated. In Delaware, I've not heard of anybody who goes to get a test having a problem getting a test. If you run into a problem, please reach out immediately to your immediate supervisor and your program leadership.
If you are a department that can work remotely, instead of furlough, can you work from home while you wait for either exemption or full vaccination?
I would say that would be a conversation that you need to have with your department leadership or your supervisor, your department leadership. I mean, that's really just difficult to answer that for every scenario on this corporate wide.
While you're there, Alicia, I'm not sure if this was answered tonight, or I'm not earlier. Employees won't get paid during furlough. Will they also not have benefits during furlough?
We are going to continue benefits. Again, it's RHD. We're going to do that for our employees during that first 30-day exemption cycle. So while you won't get paid, you won't accrue new PTO, your benefits will continue to be paid. If you've not started that vaccination cycle or had an approved exemption within that first 30 days, then they will just continue at that point after the first 30 days. So yes.
Will those who are refusing to get vaccinated and risk being furloughed, is it possible for them to be reassigned to another county where there's no mandate until the issue can be resolved?
So one thing that I could share about this is that we don't assign people from one unit to another. People are always free to apply to different open vacant positions, but we wouldn't just assign somebody from one site to another.
I work for RHD in Philadelphia, but I work in Montgomery County. Does the mandate apply to us? I'm not quite sure what they mean.
I would say that.
As the first, oh, go ahead, Brian.
I'm sorry. I was going to say it depends on you. I mean, I get that, the 4700 Wissahickon Avenue is Philadelphia. I'm not sure if that's what they're referring to. I would look at where is your work site? Where do you go every day to work? If where you go to work is in Philadelphia, the Philadelphia mandate will apply to you. If where you go to work every day is in Montgomery County, but your reference to Philly is 4700 as the office, then it would not. So it's where do you go to work? I don't know if that clarifies it all.
I'm sorry if I missed this. Are these requirements organization-wide or just for areas under current executive orders?
Areas under the mandates. Right now, it's Connecticut, Delaware, and Philadelphia.
Does this apply to Delaware, Montgomery County agencies, or Delaware County and Montgomery County agencies that are not in Philadelphia County? I think that was just answered. If we have residential program sites in Philadelphia and surrounding counties, are Philadelphia-based staff the only ones under the mandate?
I would say yes. Yes, that if your site is in Philadelphia, the mandate applies to you. So yes, some programs may span multiple counties, but the site, that particular site, depends on the county that it's in.
If a staff person receives their second shot during the first 2 weeks of October in the Philadelphia area, so I guess they're saying the 10th of October, will they still have to remain off work for the 14 days to be deemed fully vaccinated at this point?
Our understanding through the Philadelphia Department of Health is that if you've had both assuming you've gotten either Moderna or the Pfizer, if you had both shots or the single J&J shot prior to the 15th, but you've not been here long, but you've not gotten it soon enough for the 2-week period to be covered, that you can work with the same rules as an exemption. So that 2-week post-vaccination period is waived, assuming that you can do one of two things, either work 100% remotely or work in the site following the same guidelines as anyone that's got either a medical or religious exemption, meaning that you would have to test twice a week if you work more than 1 day a week, and you would have to follow all the other COVID protocols. Sandy, did I miss anything on that?
No, you're good.
I just wanted to see if Sarah had any questions. Checking.
Yeah, she
I
does.
don't at the moment.
Can I jump in and add a Delaware thing that I've not said that someone just texted me to remind me of? In Delaware, the current mandate is only applicable to the folks who are working in our residential, our behavioral health and our IDD residential programs. The mandate currently does not affect our staff that work in our ICM or ACT programs. Again, that's as of 1:40 today. But those staff, it's only our residential staff in the state of Delaware on both the behavioral health and the IDD side as of right now. Sorry, I didn't make that clarification earlier.
A question, are saliva tests, I guess, are they applicable? Can they use saliva tests? Not sure what the technical name is.
I would say that we would need, more details about what that test is and where it is. So again, reach out to your program leadership and then we can go through the mandate and risk if necessary to get back to that person.
For someone,
But the,
I'm sorry.
the nasal test is being used widely, so we'd have to definitely look into that.
For someone who was exposed to COVID by a fully vaccinated person, what do you say to that person who is hesitant about getting the shot?
I would say check with your primary care physician.
Are all unvaccinated employees?
Wait, Sheena,
Oh,
can I just go back to that last one real quick? I'm sorry. Sorry, I couldn't get myself off mute quick enough. I would also say to that vaccine hesitant person that getting the vaccine, yes, there are breakthrough cases, clearly, there's an example, but the severity of disease is so much less if you get vaccinated versus if you are unvaccinated and get COVID.
Thanks, Emily. How are test results to be submitted?
I can take this one. We have a portal that has been launched similarly to the vaccine card portal. It is available on Okta. You will use that to submit your test results. It's a little form. Instructions will be going out to the various areas of the organization as the testing mandate rolls out.
Okay, just to be clear, if you have had your second dose, you can continue to work after 10/15. Wait, let me go back. Just to be clear, if you have had your second dose, you can continue to work after 10/15 if you double mask and test twice weekly while you wait for the 2-week period.
That is our understanding. Oh, go ahead, Alicia.
No, go ahead, Bernie. No, that I was going to say the same thing.
You've taught me well. That is our understanding from the Philadelphia Department of Health, yes. And our Philadelphia Alliance organization. Yep.
Places are not accepting test appointment requests unless you have a symptom. What do you recommend? And yes, this is something that has recently come up.
I would recommend, go ahead. I'm sorry, I didn't know someone else was jumping. I would say I would recommend trying the local Department of Health. And if you're still having a problem, reach out to your local vaccine committee person. They may help you with some resources. And please let your program leadership know, because, you know, it is one of our angst that as these mandates roll out, and we are not the only one, meaning RHD, trying to meet them, there's going to be a lot of folks trying to get tested that weren't before. So if you run into a problem, please communicate with your program leadership as soon as possible.
And Sheena, I'm just going to ask you to take a second and we'll pass it to Sarah and give you a little rest.
I only have one question, but hopefully it'll give Sheena a little break to catch up. By the way, Sheena, you're doing a great job. Okay, so my question is specifically, was asked twice. So people are asking, and I think this may have already been answered, but I think it's worth reiterating. Staff are asking if they're able to test at home for the weekly or bi-weekly testing that's required.
So the at-home testing is not something that currently we are considering part of our protocols with RHD. Testing, you know, to make sure we're in compliance, testing has to be verified. So the at-home testing is not something we're currently able to accept.
And then Sheena, before you jump back in, I'm noticing there's a lot of questions about tracking. So I'm wondering if we just want to, in general, talk about how we're tracking for a moment, and then we can go to the questions.
Sherry, can you be a little bit more specific? Tracking what specifically? And
Yes,
we can
so-
answer.
Yeah, some of the questions are about, you know, tracking my vaccination card. If I only have the one shot, but not the second, how are you going to know that? I know you can only upload it if you have both. So some of those questions are about tracking the vaccination card to know if I'm vaccinated or not, which obviously leads to these other pieces of information people need in order for us to deal with our staffing. So that's a chunk of them.
Yeah, so right now we are only tracking information for fully vaccinated staff, for staff who've submitted an exemption, or starting today for the state of Connecticut, testing of people who are not vaccinated at this point. We are not tracking information for partially vaccinated staff today. I will assume that that is related to how we are going to know when we should extend somebody's furlough. They probably will need to communicate with their manager that they have gotten vaccinated during their furlough period, because they won't have access to our systems anyway. They're furloughed employees. They don't have access to our HD systems. They'll have to reach out to their manager. They will need to let them know that they have gotten their vaccine, they're partially vaccinated, and their manager will need to know to extend their furlough. Stay tuned for some process on that. We're, you know, about 2 weeks away from that point in time. So that will still be communicated out to everybody. Does that answer David, actual proof of the vaccine or actual proof that you've gotten a vaccine? So David's question.
Sorry,
in
I'm
chat.
driving. Proof that you've actually gotten the vaccine.
Yeah, you will need to upload proof that you're fully vaccinated. So that proof is required.
I was asking about proof of the first shot. So somebody says, yeah, I've gotten my first shot. How do programs track that information?
David, I don't know how to answer that at the moment, so let us get back to you on it.
Thank you.
He knows about me and Carter.
Sheena, were there any other tracking questions? I'm trying to look through one more time. Yeah, I was going to say there's one sort of related, but Tara, it's more about how we're handling temp agencies to ensure vaccination status, exemption testing. So tracking, but for our
Sherry, I can take that one as well. We are still working on the process for our outside employees, the people who are not RHD employees, our temp staff, our consultants, our contractors. We're still working through that process. We don't have it down yet. So stay tuned for that information.
But we are communicating with temp staff agencies to let them know that we're required to meet the mandate and that their staff will be required to meet the mandate as well.
Can I ask, is there a process in place for interns or students or people who are, I guess that would be, or volunteers that are coming from RHD? So there are volunteers, our students, our interns, to try.
Yes, we're working. Are you talking about vaccinations or what are you talking about?
Yes, vaccination. Yeah, for vaccination.
Yeah, so we're working on for our contractors as well as interns and volunteers, because they're all required to meet that mandate as well, to be able to enter into a separate similar system, because they won't have an employee ID number to be able to enter that information. So we're working through that as well.
And Alicia, while you're on, don't take yourself off of mute yet. I think this one is for you. Can someone provide a centralized list of all the staffing agency contacts so we can begin outreach outside of the typical 1 to 2 agencies we typically work with?
Right, we've already started compiling that in within HR, and we'll be taking the lead on that.
Great, thank you. And
if there is any agency that someone uses that you're not sure if it's on our list, please forward that information. Just email the agency name to me, and I will make sure that they are already on our list of contacts. And that is Alicia at RHD, ALICIA at RHD.org.
Great, thank you, Alicia. And I'm going to give you another rest moment here, Sheena, and Sarah has a question.
Hey, my question is, will there be a full explanation if an exemption is denied?
We will share the denial. And again, if it's because something wasn't completed, the employee will be given that information. But if their exemption does not meet the standard, then that's what we will share with them. It did not meet the standard, which is pretty laid out on the exemption form. We will be sure to provide that denial back to that employee. I don't know that we're saying, I don't know if the question is, we're going to sit down and have like a meeting with the employee to go over. That's not part of our plan currently.
I have a one more question about exemptions. Someone asked who the contact person is for exemptions. I'm guessing if folks have a question or, want to talk through the process. Is there one person?
Yeah, again, we're using an external objective third party. So there's no, for the purposes of the very things that employees expressed at the last call, which your concerns about, wanting to make sure that these things are handled impartially and objectively, that's what we're using. So we would not be providing that person's contact information for employees. If you have questions about accommodations in general, again, it's something that our HR department, your business partners normally handle. So if it's in general about how accommodations work, so on and so forth, you can always ask that information in a general form. About this specific or your particular exemption request under this particular order, that would not be something that they would be able to advise you on. I hope that answers that question. If not, let me know.
I think it did. I actually have one more exemption question, Sherry, if I can just get it in. Okay, cool. Does the population I serve, which is high risk older individuals, have an impact on the approval or denial of my exemption?
So I think, if I'm not mistaken, I'm losing track of the conversation. There was a conversation earlier about those who might be medically fragile, consumers working with consumers who are medically fragile. So if in fact you are working with a program or unit that is serving individuals who are medically fragile, and you have submitted a request for an exemption, it is possible that based upon the conditions and based upon not the conditions, the status of being medically fragile, that your exemption may not be able to be accommodated. That is a possibility.
Thanks, Alicia.
Okay.
Yeah, thank you. I just want to note it is 1:53. We can try to do maybe one or two short questions. But we will do what we did last time, which is we take the question, we save the chat, we take the questions, same with the questions, we combine them with what Sarah's received, we put them into buckets so that we can get back to you. So if your question didn't get answered, it's not that we're not gonna, we will get to it. That's the best way I can say it. We will get back to you. Sheena, I don't know if you have one more that looks like, yeah, this is one that we really need to get to before I turn it over to Marco for closing remarks.
Let me see. Okay, so if a program only receives status updates on their fully vaccinated staff, how would they verify that a staff has actually received their first vaccination shot, since programs are not collecting paper copies of test results? I think that was kind of explained already. I didn't read that through all the way. Let me see if there's one more.
And while you're looking, I do want to remind folks, please talk to your program or department leadership. A lot of these questions are really nuanced to your specific areas, and it can be hard to answer them in general. So I know that often we need you, even if we answer it, to confirm it with your program or department leadership. So I really want to encourage folks to read through the FAQs again. Sometimes when we see it visually versus hearing it, it makes more sense. And then, of course, make sure you talk to your department or program leadership.
Okay, this last one that came in is actually pretty good. Are you allowing temp staff that have an approved exemption to and proof they can work for our programs? So if the temp staff has an approved exemption, I'm assuming from their agency, are they allowed to work for an RHD program?
We really haven't discussed that at length, but right now, all temp staff.
Sandy,
Yes.
Sandy, I'm sorry. So when we have talked about that, and the challenge is that when we are hiring contractors, we have the ability to establish that expectation. The temp agency employees don't work for us, but we are able to say to a staffing agency that we require the exemption.
Can I ask one more really quick question? It's come up a couple times. I've gotten it a couple times. Who determines religious standards for exemption?
Everyone, that
Denials.
answer is on the frequently asked questions document, and we reference you to Title VII, so we're not using anything new. Reviewing religious exemptions and medical exemptions is already part of the law and part of what RHD has always had to follow. So Title VII specifically, and other portions of the Civil Rights Act is the legal standard.
Thank you. Thank you, Sheena. Thank you, Sarah. Thank you, everyone, for your responses. Let me turn it over now to Marco for closing remarks.
Thanks, Sherry. I think Renice's comments probably sums up a lot of how we might be feeling over the past hour and a half of conversation. I've already forgotten more than I heard. And no doubt we are sharing a lot of information with the larger community today, and we'll continue to need to do so. As you've heard today, as more and more information is and paths are developed as we continue to navigate what remains to be uncharted territory for us, uncharted water for us. And we've been doing that well together for the past, believe it or not, 20 months. This is our 80th town hall meeting, not that anyone's counting. So we've been doing it well. We've had our bumps and bruises along the way, but let's remember why we're doing what we're doing at the end of the day. It's ultimately how we're keeping each other safe, the folks we support, as well as our families, using proven methods and tools being provided to us, recommended to us by the CDC. It's what government's doing. They're mandating vaccines because the vaccines have been proven to help mitigate COVID-19 and the spread of COVID-19. As with anything that we do together, it's not expected that we're all going to agree. It's not expected that we're all going to bring to this conversation the same beliefs or leave this room with the same beliefs as well. But that's a choice that we're all going to, each of us need to make. This has been, I think, you would all agree, a lot of personal choices that we've made during the past 20 months, while at the same time making choices for the folks that we support, making choices for the folks in our community. Now, when I say that for the folks that we support, I mean in the care that we're providing and how we provide that care. Obviously, the folks that we support, where we can, we need to make their own decisions, including whether or not they get vaccinated. So with that said, just again, recognize that we're all feeling differently here. We're all in the same storm, but maybe in a different boat. And that those are feelings and beliefs that we're going to need to continue to work through individually, as we also continue to work through together how we are addressing these mandates, as well as our continued protocols for the organization. I do want to thank everybody for their participation today and their questions. Sheena, Sarah, your navigation of all the questions. Sherry, again, really appreciate your focus there. And I want to thank the full COVID committee, because much of what we're doing is work on top of the work that we're doing to make sure that we are providing quality care to the folks that we're supporting. Not much different than anybody else within the organization. We're all being asked to go above and beyond right now, and I'm appreciative of that. I do want to give a special shout out. I know special shout outs tend to be taboo because I might leave somebody off, but our IT group, our applications group, went extremely above and beyond to provide us the tools that we have right now to be able to effectively capture the information that we need to capture. And I think it's important that as we are going through these waters together, that we are recognizing that we have tools today that will help us long-term for many things that were created in an immediate urgent need to fulfill immediate urgent need. And I'm thankful for our IT group, our applications development team, to getting us to this place today. There's more work to do. There's more questions to ask. There's more questions to answer. So keep them coming. Talk with your program and department leadership. Share with us what we need to be doing or what we need to be considering, so that way all of our voices can be heard as we continue down this path together. So with that, I hope you all have a great rest of your day, and we'll see you next time.